So as some of you might remember, 6 years ago, the Charities began a program called the Community Health Leadership Award Program, and it is to honor what we call unsung heroes, people who are in our community who have done amazing things, who have quietly followed their calling and have been on the ground in the community working tirelessly for whatever it is that they were passionate about. And we see that every day, and we just thought that, you know, gee, we need to be sharing their stories with our entire Diocese of Texas, and in fact now the world, since we can put them all up there on YouTube and stuff now. So we're getting ready for our 7th award winner, and we'll have a dinner as we always do in October, and you'll all be on the invitation list. And I think it's October 28th, is that right? 27th. Well, don't come on the 28th because you'll miss it. Oh, darn. Since we have been focusing more on collaborative leadership, we have invited these recipients here on our panel today to share with us their thoughts and experiences. So let me start here with Sandra. Sandra Martin is the Chief Executive Officer for the Center for Child Protection in Austin and the 2010 Community Health Leadership Award recipient. Sandra is our first leader who's been selected outside of the Houston area. Next we have Mark. Mark Nichols is a dentist specializing in the care of HIV/AIDS patients who serves as the Vice President of Clinical Affairs for Bearing Omega. Mark was selected as the Charities Community Health Leadership Award recipient in 2009. And then we have Dorothy. You know Dorothy now, everybody knows her because she was on our video. You may recognize Dorothy Weston Gibbons from the video. She is the Chief Executive Officer and co-founder of The Rose and the 2008 Community Health Leadership Award recipient. So let me start with the questions. Since we have a little bit of extra time, we really have about an hour and 5 minutes. We would like to keep this energy going in the room that we are feeling, and we would like you to ask questions while we go through the next hour together. So don't save them up like we usually ask you to do. We want you to, the format is I'm going to ask the question, we're going to give them all a chance to respond, and then we'll see if you want to ask questions before we go on to the next one. We only have 3, maybe 4. So please feel free to, and don't be shy, to ask questions as we go, okay? All right, here we go. So, what are the best strategies for encouraging a group to unite with a common mission or vision when it is evident that group members have different levels of power, goals, and priorities? So we'll start with Sandra.
For those of you who don't know, can you hear me? Now can you hear me?
Talk straight in. Just talk straight into.
Hello? All right. Rarely does anybody tell me that I can't be heard, so this is a good thing, I think. For those of you who don't know, I think in talking about collaborative leadership for me, it would be important to tell you that the Center for Child Protection is a children's advocacy center. And most of our young clients have been either had enormous physical violence perpetrated against them, sexually assaulted, or they've witnessed a violent crime. And so inevitably they come with two big characteristics. One, there is an enormous amount of shame that this is somehow their fault. And the second is that their spirits inevitably are wounded. And so for me, the big thing, we collaborate and work with all of 6 public agencies that have the legal right to be involved in the investigation of child abuse. And we actually are a part of the investigation. And so I think the strategies from my perspective would be, one, I think it's important to understand that I don't view collaboration as necessarily networking or coordinating. For me, it means that you're actually involved in each other's work, that you're moving parts. And I think that one has to begin by assessing which strengths you have. That's a good starting spot. The next is what you're all doing today. And you need to keep doing it, and that's eating and playing together. Because then we begin to see people not as positions or titles, but we begin to see people as people like us. The next thing that I would say, and there's probably disagreement, I know, coming from Austin with all of the Dell and technology that's been there recently, I think that you have to work really, really hard to find the quiet time to go within yourself. I disagree strongly that all of our new information system is good, because I don't believe human development and young children are growing at the same rate. And so somehow, and last night was a perfect example for me, I didn't have television, I didn't have radio, didn't have internet. I went to bed and, believe it or not, got to sleep and got to think without being bombarded by the noise, whether it comes from shopping, studying, whatever it is. I think you have to go within and find the quiet to see what it is you have to contribute. And finally, from my perspective, I think you have to share the compliments, share the power, share the bad times, and I think you have to really find some mechanism for ensuring that information goes up and down, because information is power.
Thank you, Sandra. Mark?
Can you hear me? I think one thing that we have in common with our organizations is that our organizations are all very focused with their mission. Like with the clinic where I work, we're all very focused on treating people with HIV. So people who come to work at the clinic or who want to be involved somehow with the clinic are very focused with this one principal desires to help these underprivileged people. So that kind of brings a cohesiveness to anyone who comes and wants to help at the clinic. Then we have different levels of what's going on with the patients. You know, we have this need for immediate care, need for prolonged chronic kind of prophylactic care, and then we have this academic research kind of need to find out what's really going on with the patient's mouths and what's causing all these particular problems. So you have to integrate this need for care and providing that care, and that's one level. And then you have to deal with the psychosocial issues that the patients bring along. And I have a lot of social worker friends. I love social work. And then you have to get the universities involved. And this is where this has been the biggest challenge for me in getting collaboration, is getting the university people to come in and help, because we're talking about huge egos coming into the field. So you have to be able to open up some space in your world for these other egos to come in. And that's not always easy to do, because I have a pretty big ego, you know, and you have to have kind of an ego to do this kind of stuff. So my whole efforts in the past several years has been creating this environment where these really brilliant people can come in and contribute with research and with high-level science, and then also bring in your practitioners, and so that we can provide everyday kind of oral health care. And then you have to create this environment where everything is well, where you have room for all these different personalities to function well, and there are lots of different types of personalities involved, and that's very challenging. Yes?
How is it that when you're dealing with the academic egos, that you can actually work with them and be able to create a boundary so that they don't overwhelm you, so that they don't, so in my experience sometimes with really strong egos, they come in, they have a vision, and then they also want to propel that vision and start transforming the organization. How do you limit that?
Well, you just have, sometimes you have to get in their face and say, back off.
You know, I also think you have to die a little bit every day to your ego. I really and truly believe that you need lots of therapy if you're going to be doing collaborations.
So where's our psychologist here?
But, you know, you do have to establish some boundaries and say, you know, if you want me to help you with this, this is what you need to do for the clinic. And you have to establish those boundaries there because they will come in and want to take over everything. But you have to be, that's my job, is establishing boundaries with all these different egos.
Dorothy?
When I think of the breast healthcare arena, it's very much like what Mark is talking about. You know, we all started with this common goal and with this need to share among ourselves, but all these things are going through my head. And first of all, I want to thank y'all for that wonderful exercise, because I was sitting there at our table and watching what we did. You know, first we had a vision of what this thing was going to look like, right? And that's what I thought about when we started talking about what would it look like if we all worked together and we quit all going after the same funding dollar. And Mark touched on something there with the, monies and with being sure that you're sharing at a very tangible level. But we had a vision that we had to open the box. You know, we had to take it out of its box before we could put it together again. Now, and at our table, and I'm sorry, colleagues, but it was so fascinating to watch that those who could really put it together started putting it together. Those of us who couldn't sat there kind of watching and visiting and watching and visiting. And so those that put it together, and then it was all done. But guess what happened? Everybody wanted to play with it. Right? Now, isn't that what happens in our groups? You know, it was just so appropriate for the way I've seen, especially the Breast Health Collaborative grow. And I will tell you about this ego, and I have the great, I think it's privilege or pleasure, but I always have employees who will tell me exactly what they think of me. And I think that's kind of okay. In fact, when I had to serve on this, I went to someone who's worked with me for many years and is an employee and said, what is it that you've seen from working outside and working inside that you see in me that makes these things or helps these things? And she said, Dorothy, you don't ever treat anybody any differently. And she said, and so I think this thing of power, we have to be very careful in our own minds, who has more power than anybody else. Now, when I look at what Sandra does, she's with some powerful people. I mean, they are really strong. I'm not sure how, she does that. But I think about in our own collaborative, some of our smaller organizations, maybe by budget, are our most powerful because they're delivering the goods on the ground. And we had an experience that I may share later about when one of our collaborating partners closed their doors and how it impacted 2 major grants. That you forget how important it is when something like that happens. The other thing is, another one of my employees, when we started the collaborative, when we actually formalized it, said, Dorothy, you cannot be the chair of the first year. You're too strong. You're too opinionated. You'll be pushing everybody around. Well, so I had to step back, just like Sandra said, because I really wanted this thing to work. But more importantly, we all knew, it wasn't me, you know, I'm very uncomfortable with all of this stuff. But we all knew that it was going to take all of us to make a difference with these uninsured women in Houston and the surrounding areas. We all knew we had to work together. No one organization could do it all. We all needed each other to make it happen. So.
Thank you. Do we have any questions for the panel? Yes, Ann.
It has been my perception in the last couple of years that an awful lot of the impetus to collaboration is coming from the foundations and large grant makers. So I guess my question to all of you or whoever would like to answer is, if today you got a guaranteed funding source that was going to just let you do it the way you wanted to do it, not a funding source that wanted to dictate terms, and you never had to apply for another grant again, how much collaboration would you be doing?
Well, our mission is about collaboration. So I would have a fabulous time being able to do things that I can't do because of money. But we are very mission focused. I think the way that I hear your question, quite frankly, it's maddening for me. There are so many nonprofits now and so little money that what I've discovered is that when there is money available, people describe their way into that money. And so consequently, for many of our, and I think that's dangerous, many of our children and families, they hear about all these resources, but when they go, it's really wide, but it's very shallow. And so I think that one has to stay mission focused. And our mission actually in the Texas Family Code says that we must collaborate. So all of that money would do me no good with the headaches and therapy. I could just have fun doing all those things that I can't now.
I would do even more collaboration because the collaboration that I've done with the universities and with big research grants has, number one, made it better for my patients. I mean, we've learned more about how to manage the patients and how to better to provide safer care and treatment protocols. And then the research collaboration has given us national and international recognition. And that's really valuable to have that. And it makes it even easier to raise money when you have this really worldwide, recognition. And that would not be possible without collaboration. So I'm always looking for people to collaborate with for research and for studies and things like that. And it's huge. But it would be nice not to have to worry about funding.
Well, for the Rose, we were collaborating long before we had a term because we were in the middle. There's never any way we're going to provide treatment. And I really don't have the resources to go out into the community to engage people. I know you're hearing this, but I thank God for the time that the foundations, and I have 2 or 3 in here, and Heather Patrick is one of those that initiated a lot of this, as did the charities. But when you start having, when you go from a support letter of, yes, we like that organization, they're great, they're wonderful, they've been around for so long, to we are in agreement through a memorandum of understanding to share this money. That's collaboration, to share this space, to share this employee. Now, that's the difference here. And I am so grateful that we were forced to give a structure to it. Maybe y'all didn't have to, but it helped us to put that structure to it and made us all stronger in our application process and in knowing what we were giving. and what we were expecting of each other. I'm just amazed at how well that written down expectation has worked. So if I had all the money in the world, I'd be starting a lot of other roses and a lot of other collaborations and all this kind of stuff all over.
We need one in cardiovascular disease.
Yes, we do.
Any other questions? Okay, right here.
So when you're visioning your collaboration, once you get it started and it's actually moving and working, and it doesn't always measure up to what you envisioned, right? There's changes, some people come to the table and they don't work out. You had mentioned that 2 of your collaborators had to fall by the wayside. What kind of structure, tools, things that you use, your tricks of the trade to kind of make sure the collaboration's working, that you can revise it when needed? What are some of the strategies you use for that?
Well, for us, we re-sign that collaboration on an annual basis. And we provide great breakfast tacos and a big opportunity for all of the people who, the important people, to get to be seen and heard. But honestly, let me hear the rest of your question again, just to make sure I'm...
Well, I know when I'm working with collaborations, there's a vision, you have your grant writing part of the collaboration, but it really needs to be nuts and bolts and things need to be delivered, right? And so when you're going in and you're implementing it, you want to kind of come back to the table and measure. You want to see if everything's working. Sometimes there's changes on the collaborative that you never envisioned. It doesn't work this particular way, but you want to change it. But yet you want to stay within your vision and your mission. So what are some of the things that you do as an organization to kind of keep that going down the right track and working together?
Well, for us, thank you. That clarifies it a little bit. For us, we meet monthly, and we have an agreement that there's no finger pointing in those meetings where we rehash what's happening now. And then the other thing is that training has to be ongoing, because in my collaboration, and I would venture to say in Dorothy's and Mark's, there is turnover. And for us, there's huge turnover of frontline workers. And not from our agency, but through some of our collaborators. And so we have an organized training that we have to keep going out and doing and making sure that all of the people are aware of what we do. You can't just assume that once you've done it once, it's sort of like having to get continuing education credits. You have to keep going out and making sure that the new people coming in understand the benefit and what you're doing.
One of the areas that where we use collaboration that's not for research but for patient care is working with dentists in the community who kind of help us provide care. And sometimes things just run beautifully and everything's going well, and then all of a sudden there are issues that come up. And you have to address those issues when they come up. We don't have a formalized process of reviewing monthly or anything like that, but it's just when the issues arise, you have to address it immediately. And it's not always easy confronting a professional about the work that they're doing, That's actually very difficult.
I can imagine.
But you have to just stay on top of it, but you have to do it in such a way where they want to continue to work with you, but where that they will provide the kind of care that you want to be provided for. So it's it's very challenging, actually.
This is going to sound a little basic, but we did start with a strategic plan, a 3-year. We go over it every year. In fact, we had one of our functions that we did this last year that we had some criticism for it, and it was like, where did that come from? Well, it came from the strategic plan. So, if you go back and evaluate it every year, and I know that's just real basic, but that kind of has kept us in line. Now, I think about the collaborative and our structure and how we change we try to change our chair every year or every other year. And that brings new focus. And it's always that relearning again of the different players, kind of like what you're talking about with, we have new players come up. But there's another part where when you're in a collaborative grant together, and you know, again, because it's the charities and they're so wonderful, but you know, we were supposed to be doing, this is just an example where it can really go wrong. We were supposed to be doing this survey, which, you know, we're kind of the people, the clinical people, and we don't do all this research, and you know, we thought we were doing it right, and then, you know, we found out we weren't doing it right, and we had to go back for the, what is it, the IRB?
IRB.
Yeah. Oh my Lord. You know, and I was like, you know, up nights worrying about that. But it was another part of the process, and as Mark says, we confronted it right on and said, we got to go back to our funder, we got to go back to, you know, the very beginning. But we lost some time there. We lost, you know, some valuable time. But still, that's how we learn a lot more through our mistakes than we do through the other stuff. So.
Okay, well, yes, we did learn a lot through that. And Linda, our star from the video, was the one that helped us find our way. It's good. You just have to, you know, build on each other's strengths, I guess, when you do have those challenges. So let's move on to the next question. And this one's just a little bit different. We want to know, what has been your experience with empowering those you are leading, and especially your staff?
Well, for us, before I had any staff, my suggestion would be to try to get buy-down from the top first, because when you're dealing with police departments and hospitals and large public organizations, for us it was really important to have buy-in at the top, that this was probably a good idea. Because what we experienced thereafter were enormous turf battles and people being so afraid that you were going to be a do-gooder trying to do their job. And I think turf is almost always going to be an issue regardless of what your project is. I think that you really and truly have to view your project participants as team. You know, in probably another 18 months or so, I will be leaving the center. And one of the things that I'm really aware of is that even after this many years now of doing this job and having a great big title, there is really nothing at the center that I haven't been asked to do that I don't do, whether it's emptying a garbage can or carrying out the recycling. I think you really have to share the power. And again, it just depends on your model. But in my model, it wouldn't work for me to wear stilettos and a cute little business suit and give instructions. I'd be killed in a heartbeat. In fact, on a lighter side, before we move on, we have a new janitor. And we have a huge conference center that can seat up to 350 people. And all of our agency partners use it regularly. And Jerry, our janitor, was outside working on the plants. And he said, as I went into the meeting, he said, I don't know what y'all are going in to talk about, but I'd be careful because most of the people that have gone into that building have guns.
Mark, you don't have guns.
No, I have drills, though. And needles, too. And lots of Novocaine to stick in there. You know, everybody is so different. And some people welcome the ability to be empowered, and some people don't want to be empowered at all. They really want to follow. And you have to, decide who can I really empower and who I can't, number one. And then the people that you empower, you start to encourage them to do whatever or venture out into whatever area that they're in or need to go in, and you encourage them. And sometimes they do great work, and then sometimes you have to get the reins and start to pull them back in and redirect them. And then some people, I feel like that I'm just dragging them along with me the whole time, and that I struggle with how to deal with them still to this. I don't have a magic answer, but maybe I can find out something from other people here. But some people don't want to be empowered and other people do. And then there's some people who are on the fence who you can really help to blossom and to start to take responsibility for certain issues and things like that.
Good point. Dorothy?
Well, I think it's a lot to do with that information. I'm always amazed at what I think I say and what my employees heard could be two different things. No matter how hard I try. And I'm always reminded that power has to be invited in. It's kind of like Marcus saying, you can never grab power and keep it. You can never give power. It has to be an invitation that comes in. And I think you have to prime people to realize how powerful they are. Because just in the way they handle anything can make the difference in any program. And so I think we have to do a lot of valuing and a lot of getting out of the way sometimes. If we really want our staff or the collaborative or whatever to be as strong as it can be.
Does anybody have any questions for the panel? We have a microphone. Molly Ford right here has the microphone. Everybody has this part down. Any advice from Mark? No? And we're so shy. Speak up. Thank you.
So on the earlier point that was, is that, okay.
Yeah.
That was mentioned by Dorothy, in our strategic plan at the collaborative, it was that we put together an advocacy day down in Austin. And it was to, one, introduce who we were as a collaborative, but we followed a couple weeks behind Komen, who has an extraordinary approach to how they do their advocacy days. And we didn't really verge away from their focus. We just reinforced what they were saying. But we had the honor of having, there were about 22 of us that went, and I would say 12 of them were community healthcare workers. They were students at Houston Community College, and it was my second time to do it. And I knew how empowering it is to go and know that your voice is being heard. But it was amazing to watch these community healthcare workers, never having ever thought they would have this experience, to go down and do this. And the letters that we got afterwards, were tearjerkers of how this day meant so much to them. And it was what Dorothy's saying. It was empowering them to feel, wow, I can be heard. And I think that's important.
But share what we did with them before we let them loose on the Capitol.
We had a little mock presentation, and Dorothy was the young aide. She picked that for herself. I was the very unprepared advocate going in, stumbling over all my words. And then the executive director of Pink Ribbons Project was also with me. And we were really kind of messing up in front of these women who I think were literally shaking in their boots, thinking, what have I signed up for? And I think it actually, it worked for us. Yeah. Because they thought, oh, we would know exactly what to do because, this is what we, we're expected to be doing because we're leaders of these organizations, and we flubbed it so badly that I think it actually also empowered them to go, oh, well, I can flub up and it'll be fine. But they didn't. They were amazing.
Yeah,
They
they
were
did.
really amazing.
Are these the same women that just got their
Yes.
graduation
Yes.
certificates this
Yes,
morning?
same ones,
Okay,
yes.
I think, Susan, you didn't hear that story, we talked about that earlier. It's an amazing impact, isn't it? Okay, oh, you have another question? Well,
Yes, I think you probably can remind us of the mic. We're talking about, of course, empowering the staff and those who work in the collaborative. I'm interested to hear you speak to empowering those that you serve. That's it.
Well, you know, and I'm just gonna, again, I don't know why I'm sharing so many things that I used to think were one way and I learned it was another. But I can remember, I used to think when we started patient navigation that all I had to do, or when we were trying to navigate our women who were uninsured into the systems, I used to think that all I had to do was to give them their path report, to give them their envelope, to give them their films, and, you know, make sure they got to the right eligibility center or wherever, and they were gonna have everything they needed. And we kept finding over and over and over again they were being either rejected or they wouldn't go or whatever. And boy, that was a huge thing for us when we got our patient navigators to be able to go and be with them. That first visit, there's, you know, it doesn't matter what language you speak. When you have a diagnosis of cancer, you don't understand anything anybody's saying to you for a while. And so to me, that was one of the best things we could ever do, was to be sure that they had someone who could at least get them through that scariness of going into a hospital or a doctor's office or whatever. And, you know, that's a big chunk of our resources. But I don't think there's anything else we do that is as important as that, except at the Rose, you don't know who's sitting out there as insured or uninsured. We do all that in the background, like many of your programs do. But, you know, we're not going to start making this, you know, oh, you're one of the uninsured people. I mean, everybody, you can't tell who's who.
I think a fabulous way to empower those we serve, first of all, one of our standards for accreditation is that we be culturally diverse. And so our entire building has many different faces, different kind of an environment. And just this last week, we had an incident that really moved our staff. We start every management meeting with one of our clinicians talking about how a child was impacted by our service. And that can be a good impact story, or it can be one in which we failed. And we had a family come in, and when the forensic interviewer met her, it was very, very clear that this family was upset, you know, by the scowl on their face to just the obvious fear. And the person approaching them was about as Anglo-Caucasian looking as possible. But when she spoke to them, she speaks beautiful Spanish. And the woman just broke out into this huge smile and said, "Thank God you speak my language." And so again, it's meeting them on their turf. It's being able to empower them through interpreters, whether those be deaf for the hearing impaired or for language. And we try really hard in our intake and assessment process to know what their needs are. You know, I personally, as a human, knew nothing about how to give until I needed to be given to. And so in our outreach to families, we want to treat them with such dignity that when we help, we don't wind up enforcing the feeling that they're down.
One of the, HIV is not as tragic for the whole as it was back in the 90s, when people were just dying all over the time. There's still lots of health issues that are associated with it, but there's one factor that's still present today, and that is stigma. There's a huge amount of stigma associated with HIV. And what I want to do is to try to empower my patients to deal with this stigma, okay? And the way I approach that is, first of all, I have to know where my patient is mentally and psychologically and psychosocially. And so the only way, and I'm not a social worker, but the only way I know to do that is to actually visit with them and get to know them and get to know where they are in their community or in their family, and get to know something about them, and then I can talk with them on their level about how to deal with the stigma and how to overcome the stigma. But that takes time to do this. So I can't do it with everybody when they come into the clinic every time, and I have to selectively pick someone, you know, today I'm going to work with this person and spend a little bit more time with them to help them with the stigma issues. But that's a really good question.
Sure is. It is.
You know, I might add, it just astounds me the way sometimes our communities and our decision makers treat those people who need help. There is a bus that comes 1 mile from our center, and we've had goodness knows how many meetings about, could you just not come 1 more mile because East Austin is growing so much. And you know, they said that there are 2 theories. One, that buses, transportation should do social good, or it should be money making. And I think that meant to me that they weren't giving me that extra mile. And so plan 2 was, okay, you know, if Gail has Dream Big in her office, in my kitchen I have It's All Good. And so what we did was get a van from the bus service, put our logo on it, find a central spot that was central to most of our clients, and that our van makes regular bus runs now back and forth, because it's the smallest of things that can doom people to a life of misery or a life of empowerment. And so I think you have to be extraordinarily creative in assessing what those obstacles are to be able to meet the needs if you are going to empower.
Let me say something. Another thing that I've observed is that it's important to have a culturally diverse staff to deal with a diverse population. And it doesn't always work by a Hispanic person dealing with another Hispanic person, or an African American dealing with another African American. You have to be able to cross-link there and let the African American talk to a Hispanic or a white person, because sometimes they may be able to, or feel more comfortable to disclose certain information to someone outside of their own community than someone inside of their own community. And I see this a lot with Hispanics, that, you know, my Hispanic assistant comes in with the Hispanic patient, and yes, they can speak the same language just fine, but I can tell there's some cultural barriers that kind of go up because this is a Hispanic woman coming into the room, and I can't say certain things. So it's kind of good to have a different kind of a person to come in and deal with the patient too.
Okay, we're going to move on. If you can say your question, okay.
It's not so much a question as an observation that there's a difference between serving or managing and empowering. And one of the lessons that I've learned is if we look for ways to find opportunities to help our staff or our clients achieve something or attain something for themselves, as opposed to give direct. Not all of them take advantage of that, but it's a great gift and it's a great step forward when what we are able to provide, and what they're able to bring to the table creates a sum that's, a whole that's greater than the sum of the parts.
Good point. Of course, that's the basis of our research. So, okay, we're going to move on to the next question, which is, while there are many benefits we know to engaging in collaborative leadership, what are some of the greatest challenges or threats to the success of that collaborative leadership?
Well, for me, it's that it's TURF, turf. I think that is the hardest barrier to overcome. The other obstacle, again, for us, is that our children are invisible. The difference between a 30-year-old rape victim and a 3-year-old rape victim or an 8-year-old, who's typically the age, is that having worked with in the district attorney's office, I know that 30-year-old is going to raise Cain with everybody about any kind of mistreatment that they get, and they're going to be very verbal about it. Our little 8-year-old victim is going to be really afraid that her mother, father are going to be angry with her. And so I really and truly believe that the hardest thing for us still to work daily to overcome is your willingness to hear. I can't tell you how many times I go into a room where people say, oh, I can't see how you bear to hear about that stuff. They just don't want to hear or believe, even juries, that humans can do this to other young humans. And my comment is always, if you can't bear to hear it, how on earth can you expect them to live it? And so I think that's one of the really difficult challenges. The other is that each and every time I've seen an organization fail or a manager fail, it's because power has gone astray. We forget that this is not about us. And so, much like Dorothy said, I really and truly, we have a huge number of interns, and they're not afraid of anything. They know everything. And so they ask a lot of good questions. It really tells us the things we need to be thinking about. And I try really, really hard not to hire or particularly to supervise anybody who won't tell me when I am wrong. That's the greatest gift, and I think that's the greatest challenge, that when so many people have forgotten that it's not about them, it's about the issue, the client, our community.
Thank you. Mark?
One of the most difficult things that I have to deal with in collaborations is the egos again, but not my ego clashing with someone else's ego, but these other two people's egos clashing with each other. And sometimes there's just really no good answer on how to manage it, but I just try to get them to understand, or to I guess focus on the goal of what our collaboration is and try to get them to understand that. But I get tired of that.
Mark, you have Novocaine and drill. Needles.
Dorothy?
Oh, I think money is always a challenge. And no matter how we try to make sure that everyone's included in the pot for whatever we're trying to do, the Breast Health Collaborative has groups that have 2 employees, and then the huge groups. And so when we're trying to do a grant for, when that smaller group has put in their request, and if we don't get the grant at all, or if we get a different amount, you always have to go back and reinforce, okay, for this amount of money, we're going to be able to do this. And this is what is going to be required, and this is how we're going to distribute it. Because anytime you start to question how the money goes. That's, I mean, it just, that's your resource. Your resources are so much more than that, but boy, I tell you, I can see many times how that could have come between us, and thank goodness folks were willing to talk, and it didn't. So.
True, it's always a problem. Question, Corky?
I'm not sure if this is germane, but what is your experience with the reluctant player? The one that always comes to the collaboration but never commits anything. Have you had those?
Oh, have we had those?
Yeah.
You know, I live by little mantras, and my mantra is the best resistance is no resistance, and that actually works. You know, when you just are interacting with that person. The yes but people, I sometimes call them. Whatever you offer, they've got a yes but.
Anybody else on Corky's question?
Well, and I also think sometimes it's timing. You know, I have a couple of players that came immediately to mind, and yet when the timing was right and we tapped into what they could do, which we hadn't before, it wasn't a need yet, then they did step up. So, you know, you can wait a long time, I mean, but sometimes that timing is important.
Patience.
Patience. Okay, any other questions? Question right here in front.
Well, I guess I've heard a lot about collaborations between staff, you know, different levels of staff, and collaborations between organizations, but I'm here as a board member, and that was a request of the charities that the organizations bring the executive and one board member. So obviously, that's a theme that's going on with donors, like you mentioned, collaboration. But I don't know that boards and people who serve on boards have caught up with the level of expectation that has been set for them by the industry as far as donors go. So how do you do that collaboration? And maybe even as a donor, how can donors collaborate with staffs to help boards get to the level of where they need to be? Because they need to be, obviously, because we were requested to be here, the expectation is that we're part of the collaboration. But where's that training, where's that support for the staffs to get that done, or how do you do it?
You know, for one thing, I have a suspicion, I don't have any documentation of this except just anecdotal, what I hear from my fellow nonprofit leaders, is that a lot of our current board model is outdated. And it's something we're looking at our organization. I think when the orphan trains and the soup kitchens were initiated initially, someone with resources showed up and they put hands and dollars on the table, and they did it themselves. And now the reality is that so many people, when I first started, all of my volunteers were stay-at-home full-time mothers who were community volunteers. I don't have any of those now. They all work. And so I think we really do need to look at the model. But the thing that we do in our center is at the beginning of the year, we plan an immersion schedule. And at each and every board meeting, we have something about how our program operates. It may be a case that turned out well. It may be how the partners collaborated in such a way to save a child from slipping through the crack. It may be a doctor talking about the benefit of a camera that they now have to use in examining children. And so that we have 12 of those immersions. The problem is those are the most popular things with the board members, and you really have to limit the time so that you can do the organization's business. but your question really resonates with me.
First of all, let me say that I have Dan to deal with the board, so I don't have to.
Lucky.
And he does a wonderful job. But we have a very diverse board of directors with different strengths, and they bring so many different skill sets to the table. It's just really amazing. And we have different projects that, you know, or a certain group of the board members may be really good at this one particular project, and another group is good at another project. So we have different levels of projects going on for the different kinds of board members to do. And I'm always amazed at the dedication that the board members have, and for what they're willing to volunteer, and they help us raise so much money. It's just unbelievable. But I have an immense respect for the board members.
You know, I think that's such an excellent question because I serve on several boards, and I'm wondering if I really understand that organization's collaborative environment within their community. For the Roses Board, let's go there for a minute. The Rose has been the fiscal agent for like 6 different organizations that have since gone out on their own. So I think somewhere in there, there's that understanding that we continue to work with, you know, groups that are starting and that kind of thing. But how much they really know and how much more I could get them involved is an excellent, excellent question, and something I'm going to take back. I think you're very fortunate to be one of those board members who is here today.
Yes, and I hope you take something back too after today or tomorrow. Okay, we have a question in the back.
It's not a question, but it is a bit of an observation based on a response to a question. It's been on my mind for the whole conversation. And I think the collaboration has changed a lot over the last 30 or 50 years. Your description of the orphan trains and the kitchens, I think that's closer to collaboration, co-laboring, and people didn't stop and strategize, they responded, you know, and so people were co-laboring to deal with something. And I think that model is still much more alive in community or grassroots-driven collaboration. What we've heard a lot about today is institutional-driven collaboration, which does spend much more time talking up front and sometimes gets to the acting. Many of the collaboratives that I've participated in don't get to the action part. You know, and you get a lot of people attending that feel they want to know what's going on, but we haven't quite figured out what we're going to do yet. And I think somehow or other we've got to, in the kind of collaborations that we're talking about here, have to unpack, you know, the talk and the walk, and how we do these.
You know, I honestly think that